Hey guys, thanks for coming to talk with me about nausea and vomiting. These are two things that a lot of people have, but a lot of people don't want to talk about. We're going to talk a little bit about them. This is GI. And if you have any questions, reach out through email or ask in the comments. Basically, nausea is the feeling that you are going to vomit. And vomiting is like the actual stomach acid, coming up and out of you. So excuse me. So women are more likely to have nausea and vomiting, especially with morning sickness and anesthesia. So basically what vomiting comes from, comes from completely different stimuli. We have chemo trigger zones all over our body. So they send signals up to the vomiting center in the brain, in the medulla more specifically. The chemoreceptor trigger zone is in the brainstem, which medulla, whatever. And then nausea is in your epigastric area, which is about where your xiphoid process is. So if you don't know your xiphoid process is, take your finger and kind of find your last rib, and it's that it's like that the thing you push in. So it's like a little indent in your skin. So if you look at yourself in the mirror, you can find your xiphoid process that way. But it's like a few inches above the belly button. So basically, all of that was to tell you that nausea is usually located in the epigastric area, which is around your stomach. Epi, around gastric, stomach. So your stomach is like just the gland, right? Your stomach is not down by your pelvis. A lot of people say they have a stomach ache and they, point to their, your pelvis area. They don't have a stomach ache. They have abdominal pain. They don't have a stomach ache. So a stomach ache would be in the epigastric area as well as nausea. And the correct word is nauseated. It's not nauseous, it's nauseated. So, vomiting is protective, so it can get rid of whatever's in there that your body doesn't want to be in there. But it can be dangerous because it can cause dehydration and fluid and electrolyte imbalances, which is very common. So you need to make sure that your patient has an appropriate amount of fluid, especially in taking with the fluid that they've lost through vomiting. We'll talk about diarrhea in a little bit, but mostly vomiting for now. So, why? Why did it happen, right? So it happens. It's a very complex process. So basically, you have to you're tensing muscles and you're relaxing the pylorus and you're vomiting up. So I mean most people have vomited before, right? And what does it feel like? It doesn't feel too good, right? So usually if you haven't eaten, so if you weren't, and you throw up, it's usually bile that comes out. So that's sour, kind of tasting, bittery. And that's usually yellow. So bile is from your gallbladder. And again, that's when there's nothing else in there. And then bright red blood is a huge problem. Is a problem. It could be a Mallory-Weiss tear, which is the part between the esophagus and the stomach. So that tears apart. That can cause bright red blood. And then esophageal varices can definitely cause blood, and that's most common in alcoholics. And then lastly, gastric or duodenal neoplasm. So like cancer of the esophagus, not the esophagus, the stomach or the small intestine. So you might ask, what kind of drug therapy do we have for nausea and vomiting, right? So a lot of you may know that a lot of side effects of drugs are nausea and vomiting, right? So a lot of side effects actually of these drugs are also nausea and vomiting. But all right, so one of the things we can do is anticholinergics, okay? So if you think about it, do you know what an anticholinergic does? Okay, so it decreases secretions. So that would be an anti-nausea. So something like scopolamine. Dramamine, you could call it too. This would be transdermal, so they put it usually under your ear. And that helps with nausea. So it's an anticholinergic, and remember that anticholinergics decrease secretions. Okay, so then the next is an antihistamine, which has to do with the H2 receptors in your medulla. So it blocks the receptors, so you won't have nausea and vomiting. And then the thiophyllozines, like compazine and thorazine, are some other options. And then there's benzamides, and these basically increase gastric emptying. And then there's serotonin agonists, which is actually the most common. So, like, if you ever heard of Zofran, a lot of people have that because it has one of the serotonin agonists don't have that many side effects comparably. And then dexamethasone is management of like pre-chemo nausea and vomiting. So like anticipatory vomiting and nausea. So that's really interesting to know. And the side effects of that are dry mouth, hypotension, and it's also sedative. So a lot of these drugs here are sedative. So we have to remind patients that they can't drive, they can't, operate machinery until they really know what's going on with them through this medication. So basically, for nutrition, you need a lot of IV fluids, especially if there's a lot of vomiting. And do not have them, eat and drink right. Have them, don't have them eat and drink right away. But once oral intake is okay, you want to start with just like clear liquids, and not ice water. That's not helpful. So Gatorade and soup broth are easy to digest, but you have to worry if they have sodium, because they have sodium in them. So you have to worry if the patient has hypertension. Even diabetics, you have to worry about like what you're giving them. But those are really good to digest. And also gelatin. So yeah. That's my little spiel about nausea and vomiting. Thanks for hanging out with me today. Yeah. Bye.